All right, so listen up if you are older than 60, 65, even above 55, and you're a male and you're struggling with your hormone health, your libido, your sex drive, your motivation, your overwhelm, your inability to fall asleep sometimes with no rhyme or reason, where you'll just have a good day and then another day you'll try to go to bed and you're up till 3 in the morning, whether it's not being able to turn your mind off, raciness, or even just not being able to sleep. I want to share with you a case study that I did the other day with a gentleman who has these exact same challenges. And we did 2 really important tests. Now, I've worked with him in the past. We've looked at his blood work, we look at his dietary approaches, we look at 2 special testing, which would be the organic acid testing and a Dutch test. Both of those tests are urine tests, and the great thing about those is you can mail those kits remotely and never have to come into my office, but that's a whole other story. So anyways, the organic acid test is basically looking at your metabolites, your amino acid metabolites, meaning in analogies, what's coming out of the tailpipe. And it's great to evaluate for potential fungi or yeast or mycotoxins or oxalates, which are very nasty, inflammatory, let's call them almost like little crystals that can go in your joints and create a lot of joint pain and fatigue and really disrupt your mitochondria. It also looks at your energy pathways, how well your glucose is being utilized, looks at your neurotransmitter metabolites, looks at your B vitamin metabolites, looks at how well you're processing fatty acids and or your B vitamin depletion. And he had very high oxalates and he had very high candida yeast markers. Now, he had very high candida yeast markers a year and a half ago, and he never did anything about it. And so he did change his diet and decided to go low oxalates, which typically are going to be fruit and vegetables that can be very high in oxalate. Grains could be high in oxalates. So he changed that, and he said he didn't notice any difference. But he's recently started on an antifungal natural approach where he's using things like, let's call it like undecylinic acid, caprylic acid, digestive enzymes. So that's good because he said he didn't do it, and now he's been doing it for 6 weeks and he's already just starting to feel better. So the second point is we looked at his Dutch test. His Dutch test is standing for a dried urinary cortisol and hormone test. And ultimately that looks at your cortisol production, how much you're producing and excreting, how much of it is available, looks at your testosterone, your DHEA, if he's converting hormones into estrogens, and looks at how well he's detoxing that. He looks at his melatonin production, looks at some of the overlapping organic acid markers. And on that test, we found that his DHEA was fine, but his testosterone was low, and he was aromatizing. And so what that means in English was he's not converting his DHEA, which is a prerequisite, into testosterone, because what's happening is due to inflammation and everything we found out on the Dutch test with his microbial overgrowth and his oxalate production, he's converting his testosterone into estrogen, and then he's not clearing that estrogen out effectively. His melatonin was very high, and he told me he stopped that because he was trying to sleep better, and that ends up creating more problems. And next thing you know is you have one problem after the next, and you start putting a Band-Aid approach together, and now we have to undo all the things that were implemented to try to fix something that didn't get to the root cause, and now you have all these additional problems. So I guess the moral of the story in this gentleman's case is less is more. Following up on protocols and doing what we're recommending. So what we're going to be doing now is he's going to continue with the Candida cleanse, but I did recommend that he should try diflucan or an antifungal, because this is going on for 2 years. And in very many instances, it's important to get in and get out, meaning using a antimicrobial from a prescriptive point of view, whether it's an antifungal. I understand the hesitancy with antibiotics. Listen, I've gone there, been there, done that, but if you're working with the right practitioner and they look at all the ins and outs and exactly what microbes are showing up, it can be a very effective one and done type thing. We also recommended that he help out with his liver. His B vitamins were very depleted, and a lot of the times that will happen is when you're under stress, your body will deplete you of your B vitamins and your minerals. So we upped his magnesium dose, and sometimes it's not that you're not doing the right supplements. In his case, he should be doing 800 milligrams of magnesium per day. He was only doing 150. And I told him we could probably end the call right now. That could be the one main thing that's going to help you. The other thing that we recommended is he wanted to know, why isn't he sleeping at night? What's going on there? And I told him, like, look, he also had Clostridia. Your Clostridia infection, which is a very excitatory bacteria. Basically what it means is it inhibits your production of adrenaline from dopamine. And ultimately what that means is, so he might say, well, if I'm not producing adrenaline, why is it that I can't sleep? Because I would think that I'm producing too much adrenaline. And the body is an amazing, intelligent, no other machine like it, which is kind of weird in the sense that if you produce too much adrenaline, obviously you'll be excited and can't settle down and have your mind racing. But also in the same vein, if you produce too little adrenaline, or you're robbing Peter to pay Paul, your body isn't able to shift out of overdrive. And as a result, that can create your body's inability to fall asleep as well. So I hope that was understandable for you. If you're still with me and you're watching this, then hopefully you know that there's help out there for you. Many doctors don't know how to interpret these tests, nor do they know it exists. And unfortunately, it's not going to get covered with insurance. But if this is something you're interested in, please DM me and I can tell you how it works. Have an awesome day.